There's nowhere that I would rather be today. Welcome to our office in Uptown Scottsdale. I'm Dr. Douglas Cowan. We provide the finest in neurofeedback and counseling services, and we do hope that you learn from and enjoy this video. If you link the right person with the right treatment intervention, you'll get a day and night difference. And there is some treatment intervention out there for any given person with ADHD that will give them a day and night difference. It's a matter of just trying to find what that is. So we want you to explore this more, understand this better, so that it will just help you and your family in whatever treatment it is that you need, whatever it is, whether it's medication, counseling, school interventions, over-the-counter medications, neurofeedback, whatever it might be. If you know what it is you're really dealing with, you can get to that day and night difference much faster. So that's why we're going through this, the different types of ADD, why we think it's really important for you. So in general, there are two types of ADHD in general. And I think one day it'll probably move to really just conceptualizing it as this. And the two general types of ADHD, one is a hypoactive type. It means it's slow. It's the Winnie the Pooh type that we talked about in our last video. It's slow moving with lethargic, passive, often late, sluggish thinking, poor accuracy, brain fog, can be easily confused, just not paying attention to the right thing at the right time. Now these are most often girls. Not exclusively girls, but most often girls. And these girls are often very compliant and often want to do well. They just have to work really a lot harder than everybody else in the classroom to kind of be successful. The other main category here we're talking about is hyperactive, fast-moving, impulsive, lacks what we would call self-control or inhibition, which is a neurological issue. It's not a decision. It's a neurological issue. They say that 70% of the brain is there to inhibit the other 30%. 70% of the brain is there to say, I don't know if I would do that if I were you. And if it's not working at full speed, then a lot of things get done that people might not have wanted to do back at the time if they could have thought about it. So we have impulsive thinking, a lot of guessing. You give somebody multiple choice, they'll just guess. Give somebody a problem to solve. It's 6. No, that's not right. It's 9. No, that's not right. It's 12. Oh, that's right. Okay. So we get a lot of guessing like that on answers on things. And this is a person who may be aware of everything around them. That part of the brain that pays attention to any change in the environment is just working really well. So that can be adaptive in some situations, probably not adaptive in a classroom situation when the teacher is trying to give a lecture and wants you to notice what she's saying or he's saying. So, but it is a neurological thing to be aware of everything in the surroundings around you, easily distracted because of that. Often we see these hyperactive people working too fast, again, guessing at answers, just trying to get stuff done. So they can come across as being really disorganized. And a lot of times these are the kids who really, you give them a 20-minute math worksheet to do. And first they do it in 4 minutes. And you know they didn't do it well. So you sit them back down, you say, got to do this thing, got to give me a good job. Here we go, start over. And then it takes them 2 hours to do it. And then with all the tears and all of the consternation in getting this homework assignment done, then the next day they've lost it. It's gone. They don't turn it in. And so after all that work, they have a missing homework assignment and everybody is just flustered and frustrated at this. Well, it's in their desk. It's shoved up in their desk or it's still in their backpack. That's where it is. But the teacher's not going to go looking for it, so it doesn't get turned in. Anyway, so loses homework a lot is on my list describing the hyperactive ADHD child or teenager. And they can be very disruptive to people around them because they're just expansive. They're just big. They're a little bit bigger than life. And when you tell them just sit there in the class, just sit there, be quiet, they're not good at that. With these kids, teenagers, with adults with this type of ADHD, they're kind of at medium to high risk for oppositional defiant disorder. They can sort of, stand up against you. They're at medium risk for anxiety. I find that interesting, but the same part of the brain, more or less, that is scanning the environment all the time is also the part of the brain that can generate anxiety. So it kind of goes hand in hand with that. They're kind of medium risk for depression. Often have a family history of high rates of alcohol problems, maybe drug use, maybe a tic disorder. And they respond really, really well to stimulants. You wouldn't think so, but as a group, it's about 90% good response, 10% moderate or poor response. That's really terrific when you think about that. But why stimulant medication helping the hyperactive much better than stimulant medication helps the hypoactive, the underactive ADHD? Why is that? And it has to do with the action of stimulant medications and how it increases blood flow in the brain, and it really helps that part of the brain that says, shouldn't do that, or slow down, or think this through, or let's look at some options. That part of the brain responds really well to the stimulant medications. So that's why we get much more often, positive outcomes with medications like Ritalin, Dexedrine, Adderall, whatever it might be. And again, the right medication, the right treatment intervention, right kid, day and night difference. That's what you're always going for as a parent. Whether you're doing neurofeedback or attend and X-stress, which can be very helpful for hyperactive ADHD type. X-stress is really excellent for that. They're over-the-counter products, or whatever intervention it is that you're going to do, you're looking for the day and night difference with the fewest possible side effects that you can get. The downside is that people in this profile, they're kind of poor responders to social skills training or insight-oriented therapy, or how does that make you feel? They don't know. So this is what we're going to look at today specifically. Now remember, I break both of these two big categories down into 5 categories. And these are the 5 categories that have to do with the main characters in the 100-acre wood, because somehow A.A. Milne knew about the brain and ADHD. Not really, but he was pretty good. So we have Winnie the Pooh that we talked about in the last video. We have Tigger that we're going to talk about in this video today. The classic impulsive, hyperactive ADHD person is Tigger. And then in future videos, we're going to talk about Piglet Piglet's worried. He's anxious. He has anxiety. And so we're going to talk about Piglet. And Rabbit, who is over-focused and very rigid in thinking and gets locked in on something and, is just not flexible in terms of his thinking or the way he lives his life. He's just not flexible. He's got to get it done before he can go on to the next thing. And Eeyore, who's depressed. The whole thanks for noticing me thing. So these are the 5 types of ADHD that I've just talked to parents about for, 30 years now, and because it's easy to grasp, and the brain studies really sort of validate it. It just kind of goes along with the work that people are doing to identify the way the different brains look. So anyway, that's what we got: Pooh, Tigger, Piglet, Rabbit, and Eeyore. And let's talk about Tigger today, because Tiggers bounce. It's what Tiggers do best. So let's look at this impulsive, hyperactive Tigger style of ADHD today. So we've talked about these different elements of ADHD. Inattention means you're easily distracted by the shiny things around you or things that move around you, paying attention to the wrong thing at the wrong time. Impulsivity. You do things without thinking about the consequences. First, you blurt out thoughts. Impulsivity is often connected with lying. Mom, Dad, you know this. You ask your kid, who did that? And he says, I didn't. And he did, because he was the only one within 30 feet of it. So it's part of the impulsivity problem with this hyperactive, impulsive ADHD, is the first thing that comes to mind is what comes out of the mouth. And 15 seconds later, people are in trouble. Kids are in trouble because they're lying. If you could just sort of see this as part of the problem of impulsivity, then you can cut your kids some slack with this, because once they lie, then they're just trying to regroup enough to protect their lie so they don't get in trouble. Now, I understand lying is a moral issue, and we sort of just go, I'm not putting up with that. But if you do this instead, if you just do this for me instead, because it's part of the impulsivity problem, is say something like, Johnny, Jason, Michael, it's pretty much all their names, right? So I'm going to ask you a question, and I don't want you to say anything for 30 seconds. But I'm going to ask you a question. It's really important that you give me an honest answer, but don't say anything for 30 seconds. So here's the question. Who did blah, 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 blah? Who did it? Or did you do it? Or what happened? Whatever. And then say, don't talk. Just think about it. Because your answer, I'm going to give you one shot to get this right. So that works a whole lot better than, hey, what happened? And they blurt out an answer, and then it's not right, it's a lie, it's incorrect, whatever, and you go down that path, and you waste a lot of time. There's a lot of tears, and it's unnecessary. So we want to work with it as if it's impulsivity, that just the first thing comes out. Hyperactive is that excessive activity level for your age. It can be called excessive non-goal directed motor activity, hyperactivity. Restlessness, doesn't like to sit still, body wants to move, got happy feet, happy hands. They can barely sit in a chair sometimes. Dinner table, they're in their chair, boom, they're on the floor. It's not uncommon. And disorganized. So you hear a lot, Mom, where's my homework? Mom, where are my clothes? Mom, where is this or that, or whatever, mom. So pretty common. Tiggers like to bounce. It's what Tiggers do best. And this type of ADHD just reminds me of Tigger from the 100-Acre Wood, because Tigger's always moving, he's always bouncy, he's always active, he always acts like he's driven by a motor. He's always bumping into people. He's nice. He's not a mean person, or Tiger, but he's always going. He's always moving a little bit too fast and stops a little bit too slow. So we see this a lot with hyperactive kids, teenagers, even not so much after the age of 20. You get this other little brain growth somewhere in the young 20s, and then again for males right around 30 years old. So we get this sort of transition in the hyperactive part. Children can be kind of pretty out of control. And then they sort of have a brain growth around 11, 12, 13, and they get a little bit more self-control there. So they might be impulsive, but less hyperactive. And then in the 20s, still impulsive, making bad choices maybe, but less hyperactive. And then around 30, many, maybe most, kind of outgrow it. And all of a sudden, the kid who was 8 years old and just out of control in third grade is your banker sitting behind a desk. I mean, it's weird, but it happens a lot. And this is kind of the group too that the business coach that I quoted in one of the first ones, Dan Sullivan. This is a guy who charges $25,000, $100,000 a year for entrepreneurs to be coached by him. So he coaches rich people who make a lot of money, and he helps them make a lot more money. And he said that he figures over the last 41 years of doing business coaching with powerful entrepreneurs, he figures 60% of them were ADHD, and primarily this type of ADHD. A lot of energy, can be very creative. And so as parents, if we can really focus and channel our kids and teenagers to learn the things they need in order to be successful in school and in life, they might end up being some of these entrepreneurs who are kind of changing the world and making money doing it. So I'm kind of excited about about these kids, as long as their parents can really train them and focus them in the right directions. So one of the characteristics about these impulsive, hyperactive kids and teenagers with ADHD is they can be easily distracted. That's because anything that moves, they're going to look at. You can have the most boring speaker in the world, but if their hand moves, you got to look at them. Anything that moves. Our brains are just built like that, and their brains are really overactive in that whole, if it moves, I got to see it. So they can be easily distracted by things. Imagine putting them in a classroom with big windows they can look out, and outside there's kids playing. They're looking at what's moving. They're not reading their books. So that's pretty common. So easily distracted is part of it. Can have a lot of energy, can sometimes not need very much sleep. And that can be a real bother if you're a parent who needs 8 hours of sleep every night, because sometimes these are people who need 4 hours of sleep. And that's, by the way, one of the tricks with that, if you have a child, maybe a teenager who just can't go to sleep, wakes up early, ready to go, boom. So I had a psychiatrist friend, Cliff Corman, passed away several years ago, but Cliff was really good with ADD kids and really good with medications. And he told me that you could just have the doctor, give the child a small dose of Ritalin at bedtime, at like 5 milligrams of Ritalin. And he said that the kid's brain sometimes could organize enough that it could actually sleep through the night. That was his advice, and a lot of parents I've known have found it to work. So that means, if you're not up for that, it might be something like a cup of coffee and a protein drink, or something with a little caffeine in it and no sugar, not much sugar, and see if that helps the brain to organize enough or inhibit itself enough to sleep. So a little trick there. And again, I'm not a medical doctor, so I'm not telling you what to do with medication. I'm just telling you what Cliff told me, and it worked for some people. So talk to your doctor about that, because it may be helpful. These are people who are hyperactive, as we talked about. Excessive non-goal-directed motor activity sort of defines that. They can't sit still very long. They can be very fidgety. This is the happy hands, happy feet thing in kids. Feet are always moving, hands are always moving. And this is where the fidget spinner comes in. I'm not a big fan, although I like mine, but I had some kids in my office and it disappeared. But fidget spinners, they're kind of fun, but if you can only focus on one thing at a time, they're kind of a bad idea in the classroom, because you're looking at the wrong thing. You're looking at the fidget spinner instead of reading your book or listening to the teacher. But they can be kind of fun, Mom and Dad, around the house or in the car or wherever you kind of want a little bit more calm. Yeah, why not? They can talk a lot, just like, you pull the string and they start talking. Once they get into something, they can talk a lot. And can often be very loud, like they don't understand just how loud they're being. They can just blurt out something real loud and yell at their sibling real loud and whatever. So if you put the word very in front of pretty much everything they do, they can be very happy, very sad, very loud, very active, very whatever, then that sort of works for these kids a lot. The impulsivity, again, is not thinking before you take action. Just not looking at your options. And that's not bad training, is to start, and we'll talk about this in other videos, training your impulsive, hyperactive child or teenager how to think through what's going to happen after they do something, and what all their options might be, and how to pick the best choice before they make a decision. But the brain just wants to go. The go part of the brain is revved up, and the stop part of the brain, not so much. So if you think of it like you got a Mack truck and it's got bicycle brakes, it's kind of what we're dealing with. Maybe a Ferrari. That's kind of what we're dealing with here. So you can have trouble waiting your turn in line. I mean, when the teacher says, okay, everybody line up and wait for 5 minutes, probably not going to happen, at least not well. Waiting your turn in games. You got 5 people playing a game. It's a board game. You're going around the room and then come back to that person. It's not going to work well. So you can also see this as a problem in team sports. I'm a baseball guy, and outfield, not good. It's not good for anybody with ADHD. It's just not good. Not good. The hypoactive, that's inattentive, not a place to put them. Hyperactive, not a place to put them so much. Let the kids play in the infield. Let them be catchers. Let them be pitchers. Let them get after it. So, but a sport like swimming might be great. Individual sports could be great. Tennis could be good. You can see lots of things like that going. This type of ADD results from underactivity in the prefrontal cortex. Let's think about this first part of the brain. It's underactive. It's underactive both when it's at rest and when you give it a task to do. It gets even more underactive. So it's always just kind of trying to figure out what everything's about and paying attention to the right thing and so on. But then you give them a math worksheet to do and watch this kid fall asleep. Just go to sleep, because that part of the brain just works less and less and less under a workload. So imagine you tell your child who is like this, go to your room, pick up the clothes off the floor, put those shoes away, and then the laundry that I folded and put on your bed, put it in your drawers, and then come on back out. Now, you see this as a pretty simple task, but that was 5 different things you just told your child to do. Unlikely. Child's going to go in the room, you're going to come in 5 minutes later and say, are you done? And he's going to say, no. So anyway, try to break things down more, try to help them more, try to help them go with 30-second things at a time. Do one thing, come back, I'll give you another one. Here's a flashcard or a 3x5 card that's got the thing to do on it. Go do this, bring it back. I'll put a check mark, gold star on it. Here's another one to do. Go do this, bring it back. Works a lot better. We just start from the ground, work up. So the frontal lobes help us to pay attention to tasks, focus, concentration, make good decisions, plan ahead, learn from mistakes that we've made in the past, remember successes that we've done in the past. Frontal lobes help us to do all of that, help us to behave appropriately in a given situation, help us with emotional angers, inhibiting emotional things like anger. Help us with emotional issues, like anger, inhibiting frustration, irritability. And when that part of the brain's not working good, those things leak out. You get more angry, frustrated, irritable. The inhibitory mechanisms of the cortex. It's a long phrase, but it's the brakes we're talking about, the bicycle brakes. So they keep us from being hyperactive or saying things out of turn or for telling lies. I mean, if you have good inhibitory control, you can think things through and you lie, you lied. But if you just blurt stuff out, it's weird. It's a tough call. You say, hey, think about that. I'll give you 30 seconds. Let's come back with the honest answer. See what happens. Talked about that a minute ago. It's been said 70% of the brain is there to inhibit the other 30% of the brain. And so when these inhibitory mechanisms of the brain aren't working as efficiently as you'd like them to, as they ought to, then we can see results of what's sometimes called disinhibition disorders. Lack of inhibition disorders. And these are impulsive behaviors, quick temper, poor decision making, hyperactivity, and so on. So with a child, your big problem might be the hyperactivity. With a teenager, it might be bad decisions over and over and over. And they can get in a lot of trouble. So that's why we got to guide them, got to guide them. The limbic system is the base of our emotions. It's the vigilance part of our brain. It's there to keep us alive. It has a lot of fabulous things that it does for us. And it's 22 different structures in the limbic system. And it works as a system. It's a whole system. And it works with other parts of the brain. It tries to interact with the frontal lobes, tries to interact with some of the other parts of the brain, the decision-making parts of the brain. And when it's overactive, then a person can have wide mood swings or temper outbursts, might be over-aroused, easily startled. So we look at them as like drama people, but they're just being easily startled. They can often be the people who are touching everything around them. For whatever reason, I go into a store today. I'm 61 years old. I go into a store, my hands go in my pocket. Because somewhere when I was about 4, That's where my hands went in a store. So, touching everything around them, even in a store, can be a bad thing in a store. They can be hypervigilant, just aware of everything in the environment that's moving around them. So a normally functioning limbic system would provide for normal emotional expressions, normal levels of energy, normal sleep routines, normal levels of coping with stress. But when the limbic system's kind of out of whack, over-revved, then we get problems in those areas. So ADHD can affect one or two or three or all of these areas, and that's why we get these different profiles of ADHD. I'm going to show you a picture here. We'll go over this picture here just real quick. So here are some of those really great brain pictures. They're just cool. And what you see, here's what I want you to see in this picture for the impulsive, hyperactive, Tigger type of ADHD is you have on the left-hand picture, these are deficits in activity, deficits in energy. They're not holes in your kid's head. They're just deficits in activity. And so the brain of the impulsive, hyperactive person in the frontal lobes is pretty much always underactive. And under a workload, they remain underactive and can become more underactive. And that's why it can be very difficult to sort things out, figure things out, restrain yourself, make good choices, and why it can be so hard to do some homework assignments, and why they might fall asleep or have to get up and move around and not fall asleep when they're doing certain projects. So that's the activity of the brain. And then you'll notice the slide on the right, in looking at the limbic system, it can be overactive, and that can cause some of the mood issues that we talked about, the hypervigilance, touching everything, and so on. And we're going to see that slide again, especially when we talk about piglet and anxiety, that the brain can be over-revved in other parts of the brain. So you can have deficits in one part of the brain and be over-revved up in another part of the brain. So that's it for the Tigger type of ADHD. Again, remember, they respond to some kinds of treatments really, really well. So if you can find that particular thing that will help your child or your teenager, it'll make a day and night difference. I'm sure you're going to be excited about that. And let me just tell you again, parents, if you can focus these kids and help them learn how to be successful at this time in their life right now, just do it. Do the best you can with them. Learn all that you can about them. I'm telling you, these kids can change the world, and they can get paid doing it. So they can have a lot of energy, be very creative. Just say, I'm going to get this done, and go do it, go achieve their goals. It can be great. It also can be a train wreck if it doesn't work out so well in their childhood or teenage years. So we want to do the very best we can so this turns out with a happy ending for everybody.